Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about resuscitation services policy, cardiopulmonary resuscitation. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. This policy is applied to all medical, clinical, nursing, and supportive departments of our hospital. The purposes of this policy are: 1. To ensure immediate and appropriate response to all events of cardiopulmonary arrest. Number 2. To ensure the prompt and skilled circulatory and ventilatory resuscitation for patients who suffer a cardiopulmonary arrest by a designated team. Definitions. One, cardiac arrest is the sudden and complete loss of cardiac function. It may be due to ischemia, infarction, or fatal arrhythmia. 2. Respiratory arrest is the sudden and complete cessation of breathing. 3. Basic life support compresses the elements of initial assessment for responsiveness of the patient, checking for breathing, calling or shouting for help or code, then starting steps of CPR with chest compression followed by tube breathing with significant emphasis on performing high-quality CPR. 4. Advanced life support implies the use of accepted techniques of external cardiac massage, oxygenation and airway management, cardiac arrhythmia recognition, cardiac defibrillation, and drug administration in an orderly attempt to restore spontaneous cardiopulmonary and cerebral function, and post-resuscitation care. 5. Healthcare professionals refer to the clinical staff responsible to make assessment of patients to provide care to them. These include physicians, assigned nurse, physiotherapist, nutritionist, patient educator, social worker, laboratory technicians, and radiology technicians. Number 6. Code blue or green will be used to summon a team of trained medical personnel to undertake cardiopulmonary resuscitation for arrested patients. Code blue applied to all adults anywhere in the hospital, and code green applies to all children anywhere in the hospital. Number 7. CPR code team is a multidisciplinary group of medical personnel appointed to respond to code calls. The members of the CPR code blue or green team will be acquired with pagers that are programmed for the code alerts and should respond to all alerts in the hospital except in closed areas. Team members include staff nurse of the area, nursing supervisor on duty, ICU physician, respiratory therapist, anesthesia technician, physicians on duty, medical specialist and resident in case of code blue, and pediatric specialist and resident in case of code green, pharmacist or pharmacist technician, and security guard. Number 8, code team leader will be medical specialist on duty in event of code blue, pediatric specialist on duty in event of code green, ICU specialist in event of a code in ICU, attending anesthesiologist in event of code in OR, PICU specialist in event of a code in PICU. The team leader will have the same responsibilities anywhere in the hospital. Number 9, medical staff in closed areas like ICU, OR, RR, or PICU will run any code in the event of an arrest with their own code team members. Policy statement. 1. All patients found to be in a state of cardiac or pulmonary arrest will have a code blue or green alert by paging. 2. All personnel participating in code blue or green procedures shall use appropriate standard precautions to protect themselves. 3. CPR code team members should carry out their assigned tasks, ensuring that there is only one clear team leader as per the delegated process. 4. Team leadership should be established at once by the first attending ACLS/PALS certified physician, and it should be endorsed only once to the assigned team leader once arrived. 5. All physicians, according to their specialty of the code team, should be trained in current ACLS/PALS programs and should be certified with most updated provider courses. 6. During a code, all the team members are anticipated to work together in harmony and cooperation, keeping mutual respect for all team members. 7. Designated primary responders of the code blue or green team will not be permitted to leave the hospital building during their defined shift time unless he or she has delegated his or her responsibility to an appropriate member of staff of the same grade and experience. 8. There is no time frame limits for CPR procedure. The decision of cessation of CPR procedure will be the responsibility of the team leader. 9. All team members should stay at the area of arrest till the CPR event is over and patient is stabilized and or being transferred to critical area for admission. Responsibilities. All code team members will endeavor to get the scene of the emergency or arrest as soon as possible. Staff nurse of the area within 0 seconds to 1 minute. Nursing supervisor, respiratory therapist, and resident within 1 minute to 2 minutes. other team members within 3 minutes time. Staff nurses of the area. First nurse who discover a patient not responsive and not breathing become the first rescuer. He or she immediately shouts for help or initiates the code blue or green alert as instructed if alone. He or she remains with the patient and starts resuscitation, starting with chest compression if needed. Second nurse, who is in or near the area, will activate self-dialogue for code. Each area has its own code number, or call the telephone operator to initiate the code blue or green and will ensure that it has been done. Second nurse will bring the crash cart quickly to the area and play a role as the second rescuer in CPR till arrival of ICU or ER staff nurse who will replace the second ward nurse. A senior ICU staff nurse will attend any code in the ward areas. A senior ER staff nurse will attend any code in all other caregiving areas like RDU, endoscopy unit, radiology department, OPD, and administrative offices. Nurse supervisor, code blue coordinator, carries code blue. Responds immediately to all code alerts in all areas of the hospital. Supervises the overall management of an arrest situation. Ensures all team members have arrived to the scene or take appropriate steps to ensure their arrival. Ensures crash cart arrival and dispatches for any other supplies urgently required. Maintains crowd control. Dismisses those not required for other duties and also unwanted guests. Assists in CPR if needed or if insufficient personnel present. Informs the code team that what medications patient is on, and call designated number to confirm that all members of the code team have responded. ICU physician. He or she should respond to all code alerts in all the areas of the hospital except in pediatric ICU and OR. He or she is expected to be conversant with all steps of basic life support for adults, children, and infants. He or she is expected to know advanced cardiac life support for both adults and children, including infants. He or she will also be familiar with some, if not all, of the steps of prolonged life support and conditions of difficult intubations. In order to secure the airway and provide breathing support, he or she will be expected to know and be able to perform the following. Use mouth to adjunct ventilation. Endotracheal intubation within 30 seconds and ventilation, manual or mechanical. Once the airway has been secured and checked for proper placement, the ICU physician may delegate breathing support to a respiratory therapist or another member so that he or she may then proceed to perform intravenous cannulation for the purpose of administering drugs, fluids, or blood samplings, and intra-arterial cannulation for blood gas analysis. If the event that the ICU physician needs to initiate appropriate intervention in the absence of other physicians, for example, defibrillation and administering of appropriate drugs, he or she will be expected to do so. The ICU physician will liaise with the assigned nurse at CPR to make a record of the drugs administered by him or her. And he or she will also make a report of his or her part of the emergency, and in the event of mishap occurring, he or she will submit a full report to the CPR committee or to the head of ICU department. Respiratory therapist. He or she should respond to all code alerts in all the areas of the hospital except OR and pediatric ICU. Assist in advanced procedures as requested by the team leader, for example, ventilation and intubation. Prepares equipment for advanced procedures if not already done, for example, prepares intubation tray. Assist in resuscitation action as necessarily pending the arrival of other team members. Monitors resuscitation attempts in order to identify any problems, for example, equipment or supply problems. Performs any tasks assigned to him or her by the team leader during active CPR procedures. He or she must maintain current valid certification in PLS. Anesthesia technician. He or she should respond to all code alerts in all the areas of the hospital except ICU and pediatric ICU. Response to code call and bring emergency anesthesia medications kit used for pre, during, and post intubation of the patient. He or she will be the one to administer emergency anesthesia medications. Performs any tasks assigned to him or her by the team leader during active CPR procedures. He or she must maintain current valid certification in PLS. Medical or pediatric specialist on duty. He or she is the code team leader in all the areas of the hospital except enclosed areas. He or she will be the overall team leader of the code procedure. His or her main tasks are to coordinate, direct, and supervise the entire resuscitation procedure. He or she is expected to be trained in all basic as well as advanced cardiac life support procedures and maintain current certification in ACLS or PALS. The team leader is responsible for all of the following: supervision of the performance of all code team members. He or she will order what drugs or procedures are to be administered or performed and to be over in charge of the procedure. Recognition of ECG patterns, indications and use of drugs, safe recognition of defibrillation, temporary pacing, interpretation of laboratory results, order ventilation with ambu or endotracheal intubation, or in the case of the delay of the anesthesiologist, he or she may perform such a task. He or she should be familiar with the indications of successful CPR and reports in the cardiac arrest chart all data pertinent to the procedure. The team leader is responsible to discuss the need and seek advice from other departments. The decision of cessation of the CPR procedure will be the responsibility of the team leader. Medical or pediatric resident on duty. He or she should respond to all code alerts in all the areas of the hospital except enclosed areas. He or she should participate actively in resuscitation according to the needs of the situation under the direction of the code team leader. He or she is expected to be trained in all basic as well as advanced cardiac life support procedures and maintain current certification in ACLS and BALS. He or she is expected to recognize different life-threatening ECG patterns, to know the indications and use of emergency drugs, and to know safe use and indications of defibrillation. Pharmacist or pharmacist technician. He or she should respond to all code alerts in all the areas of the hospital. Pharmacists should supervise and prepare the medications used during CPR procedure. During a code, emergency medications kit will be brought by the pharmacist or pharmacist technician to provide immediate backup for medications and to replace the used medications immediately after the end of a code. Security guard responds immediately and stands outside the code area and ensure that visitors are not permitted into the area. Takes responsibility for removing any visitors that are not required as directed by the nursing supervisor. Procedures. Number 1. Any person who finds a patient in apparent cardiopulmonary arrest may shout for help. This person must stay with the patient and summon help by whatever means are available. For example, by yelling or pressing the emergency bell button at the patient's bedside. Number 2. A healthcare professional who discovers a patient in apparent cardiopulmonary arrest becomes the first rescuer, immediately shouts for help, or initiate the code blue or green as instructed, remains with the victim and starts CPR. Number 3. In order to summon the code blue or green team, the first or second rescuer activate self-dialing for code or calls hospital telephone operator on and notifies about the code blue or green indication in clear order. For example, this staff nurse Abdullah, code blue, male medical ward, room 109A. Number 4. The telephone operator shall announce 3 times the code blue or green on the overhead paging system, that's to say the location of the code blue or green in words. Activation of the emergency tone device shall precede the announcement of a code blue or green. Example in English. For adult patient, attention, attention, attention. Code blue, specified location. Code blue, specified location. Code blue, specified location. For pediatric patients, attention, attention, attention. Code green, specified location. Code green, specified location. Code green, specified location. The operator will notify the administrative coordinator on duty about the code. Number 5. Chest compressions and ventilation shall be carried out by the first rescuer on the scene. Therefore, thereafter, the responsibility will be directed by the code team leader. Number 6. Crash card will be brought by the second rescuer at the scene, and he or she will take part in the CPR along with first rescuer. Number 7. Both first and second rescuers will start steps of CPR according to PLS algorithm as two rescuers till arrival of other team members. Number 8. Rest of code team members shall reach the arrest scene as soon as possible and continue the resuscitation in collaborative manner. There should be only one team leader during CPR event. All team members should keep and maintain high quality CPR, including effective chest compression. Push hard and fast at a rate of 100 compressions per minute for all ages with enough depth. Allow full chest recoil after each chest compression. Minimize interruptions during chest compression. Avoid excessive ventilation. Rotate or change compressor every 2 minutes. After placement of advanced airway, normal compression-ventilation ratio is to be followed. Compressor man should continue compressions at rate of 100 compressions per minute without interruption. Ventilation man should give one breath every 6 to 8 seconds, 8 to 10 breaths per minute. Number 9, defibrillation of the patient should be administered by ACLS/PALS qualified healthcare professional. Thereafter, the responsibility will be directed by the code team leader. Number 10, intubation of the patient should be done by the ACLS/PALS qualified healthcare professional. Thereafter, the responsibility will be directed by the ICU physician or code team leader. Number 11, the documentation of CPR event shall be done by the nurse supervisor in the specified CPR event recording forms, which will be countersigned by the team leader at the end of CPR event. Number 12, the patient shall be moved from side of code to an appropriate area if necessary, only after the patient's condition has been stabilized. The choice of appropriate area for the patient shall be at discretion of the code team leader. Whenever possible, the code team leader should consult with the treating consultant or his designee prior to this decision. When this is not possible, the code team leader should consult with the treating consultant or his designee after patient stabilization and or transfer. Number 13, if the patient is to be admitted to any of critical units, the staff of that area should be contacted and informed prior to transfer. The patient being transferred to critical units will be accompanied by the ICU physician, the medical or pediatric resident, and staff nurse. All documentations should be transferred with the patient, including medical chart, nursing observation sheet, and CPR event recording form signed by the team leader. Management, care, and follow-up of all post-CPR intubated patients outside ICU will be the responsibility of ICU team, admitting and treating physician, and assigned nursing staff of the patient's care area. Number 14, code coordinator shall request the security staff to clear the code area from unrelated persons. Number 15, here are some special considerations that will vary from one hospital to the other according to the structure and the design of each hospital and the relation of different departments with each other. Attachments of this policy are CPR event recording forms, 2 pages, and false CPR event recording forms. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.